Hello friends, so now we'll be discussing about vascular anomalies. So before starting, I would like to thank Chandana Shri Ma'am for sharing the wonderful notes with us. These notes are very helpful and very helpful for revision. And the link for the notes is given in the description below. You can download it from there for ease of revision. And let's get started. So vascular anomalies, these are divided into vascular tumors and vascular malformation. So vascular tumors could be benign, locally aggressive or malignant. Vascular malformation could be slow flow or fast flow. So to see in detail, vascular tumors benign are infantile hemangioma, congenital hemangioma, tufted hemangioma, spindle cell hemangioma, epithelioid hemangioma, pyogenic granuloma, and etc. Locally aggressive are Kaposiform hemangioendothelioma, Kaposi sarcoma. Aggressive ones like the malignant ones are angiosarcoma, epithelioid hemangioendothelioma, etc. So now we see the vascular malformation, which are divided into slow and fast flow. Slow are capillary malformation. Among these is the port wine stain, which are flat pink patches seen in the Sturge-Weber syndrome. Venous malformation, which could be skin, mucosal, or in the subcutaneous tissue. These are misnomers of cavernous hemangioma. Then we have lymphatic malformation, that is macrocystic, that is cystic hygroma. Microcystic, that is lymphangioma. Visceral lymphatic malformation, that is lymphangiomatosis. Combined malformation in the Klippel-Trenaunay syndrome, that is capillary lymphatico-venous malformation, Maffucci syndrome. Fast flow could be arterial malformation, aneurysm and ectasias. Combined malformation like arteriovenous malformation, AV fistula. Combined arteriovenous malformation, combined lymphatic arteriovenous malformation. So these are seen in the Park-Weber syndrome. Now the hemangioma, these are the endothelial tumors, superficial red in a color, superficial are red in color, dermal deep are blue in color. Then we have infantile hemangioma, that is capillary hemangioma, also known as strawberry hemangioma, which is seen in the postnatal proliferative phase in around 9 months. Generally these involute यानी खुद ही ठीक हो जाते हैं 50%. रेसिडियल ट्यूमर्स के लिए सर्जरी लगता है. मल्टीपल हेमांजियोमा हो सकते हैं. देन कंजेनाइटल हेमांजियोमा जो रेड वॉयलेशियस होता है, कोर्स विद टेलेंजेक्टेसिया होता है, फुली ग्रोन एट बर्थ, पोस्टनेटल पीरियड में ग्रो नहीं करते हैं जैसे कि इन्फेंटाइल हेमांजियोमा करते हैं. रैपिडली इन्वॉल्यूटिंग, दैट इज RICH, रैपिडली इन्वॉल्यूटिंग कंजेनाइटल हेमांजियोमा, और नॉन इन्वॉल्यूटिंग दैट इज NICH. एक ट्रीटमेंट क्या क्या हो सकता है इन दोनों के लिए? एक्सीजन, स्क्लेरोथेरेपी, पल्स डाइड लेजर फॉर्म, ये हो सकता है. Then we have pyogenic granuloma, that is lobular capillary hemangioma. So it is solitary red papule with a stalk, 90% in case of skin, in the most commonly in the head neck area, then 60% in head neck area. 60% in the head neck area, 20% in trunk, and 20% in the extremities, 10% in the mucous membrane. So these have immature capillaries among the interspace fibroblastic tissue which resembles the granulation tissue in the edematous matrix. इसमें क्या होता है? Bleeding, crusting, shrinking and regrowth. It is common increased in pregnancy due to progesterone effect. Treatment is with excision, laser and electrocauterization. Then we have cirrhoid aneurysm, which is rare fistula, rare AV fistula or malformation which is seen in the scalp, very rarely in the extremities. Congenital anomalies which can be traumatic. 90% in relation to the superficial temporal artery, rarely through the occipital artery. Along with superficial temporal artery, scalp facial lesion, marked tortuous subcutaneous lesions, vessels which are pulsatile. Rarely they can cause bone thinning and extension into the cranial cavity. Complication are ulceration and hemorrhage. Evaluation with help of Doppler, ultrasound, CT, angio and X-rays. Treatment will be ligation of the feeding vessel followed by excision, endovascular or percutaneous modality of therapy. Then we have aneurysmal varix or AV fistula, which we have seen. So AV malformation and AV fistulas. So AV malformation are congenital anomalous vascular connection between the artery and vein. मतलब बचपन से anomalous vascular connection है between artery and veins विदाउट इंटरवेनिंग कैपिलरी बेड्स जो नॉर्मली होते हैं. ठीक है, इसमें क्या हो रहा है, मल्टीपल लार्ज फीडिंग वेसल होगा, न्यूमरस एवी कनेक्शन होगा, कम्युनिकेशन होगा. अगर ठीक से एक्सरसाइज नहीं किया तो रीग्रो करेगा. कहाँ कहाँ पे मिलता है, लिम्बस विसरल, जहाँ पे लंग्स, लिवर, बॉवल, ब्रेन, स्पाइन. पैथोफिजियोलॉजी क्या होगा इसमें, स्ट्रक्चरल चेंजेस रिजल्टिंग इन लिम्ब लेंथ एंड गर्थ इंक्रीज, इरोजन ऑफ द सबजेसेंट बोन, फाउंड थ्रिल एंड मर्मर. फिजियोलॉजिकल चेंजेस क्या क्या होगा, हाइपरडायनेमिक सर्कुलेशन विद सीसीएफ. कॉम्प्लिकेशन क्या होगा, हेमरेज, थ्रोम्बोसिस, एम्बोलिज्म और सीसीएफ. ट्रीटमेंट क्या करेंगे, सर्जिकल ligation of the feeding vessel followed by excision, embolization and excision if needed. Then we see AV fistula where there is acquired communication between artery and vein. Surgery के बाद generally होता है, usually single communication. Secondary to trauma, obliteration of the communication will suffice. लोकेशन कहाँ है, कहीं भी जहाँ पे ट्रॉमा हुआ है, ट्रंकल एक्सट्रीमिटी विसरल. पैथोफिजियोलॉजी हाइपरडायनेमिक सर्कुलेशन at various levels. At fistula level there is dilatation and formation of the aneurysmal fibrous sac which is warm, pulsatile, soft, compressible swelling, continuous machinery murmur. Distal to fistula, due to diversion of the arterial blood, distal part becomes ischemic and there is high pressure arterialization of the veins, development of the varicose vein. Proximal, that is Branham or Nicol-Doni sign, pressure over the artery proximal to the fistula. There will be decreased swelling, decreased pulse rate and decreased pulse pressure. Now we see the investigation for these AV malformation of fistula, which is Doppler, CT, CT angio, echo and ECG. Surgery for AV fistula is excision of the fistula, reconstruction of the artery and vein with graft. In emergency, we have to go for quadruple ligation, Hunter ligation, where we ligation of the feeding artery. It should not be done unless you have collaterals which may result in ischemia. And quadruple ligation, we ligate all the four supply for this connection, that is two venous and two arterial. So this was all about vascular malformations, vascular anomalies, which is classified with help of ISSA, International Society for Vascular. I'll confirm and let you know. Thank you for watching. Keep studying, keep growing, and please like, share and subscribe. See you in next video.